Medicines are important because it helps you with your health conditions. However, there is one thing that I don't like about it. Some medicines can actually damage your nerves and cause neuropathy symptoms. That's why in this video, you will know about those medications. Stay with me until the end for you to know if there are existing medications that is actually aggravating your neuropathy symptoms. And for you to know about the 3 things that you can do to actually prevent this from happening. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. Clinical studies have actually proven that medicines, although prescribed with good intentions, can sometimes cause damage to your nerves. Now, before we start this video, I want to make it clear that you should not in any way stop any existing medications that you have that will be mentioned in this video, not unless you are cleared by your doctor because it may be unsafe for you. There is a new study published in Current Clinical Pharmacology which aimed to check the effects of certain medications on your nerves. These research have found that such medications can actually create and give you neuropathy symptoms. Heart meds. Antiarrhythmic drugs like amiodarone, which are actually given and prescribed for persons who complain of irregular heartbeat or arrhythmia, have been found to actually damage the nerves. In the study, it found that antiarrhythmic drugs can actually affect both sensory and motor nerves. Now, what does that mean? Long-term use of antiarrhythmic drugs can actually cause neuropathy symptoms like numbness, pins and needle sensation, and even sharp shooting pain. Use of antiarrhythmic drugs have been linked to the loss of myelin sheath or the covering in your nerves, which is very much important for your nerves to function well. Statins. Simvastatin, pravastatin, and fluvostatin, which are actually universally prescribed to help lower cholesterol levels, have been linked to nerve damage. The study actually found that those who had neuropathy symptoms who were using statins had statins for greater than 2 years. Now ask yourself, how long have you been drinking your cholesterol-lowering drugs? Although these heart medications are very, very important to prevent cardiovascular attack and even death, it is still very important for you to be educated on its possible risk factors so you can do something about it. Levodopa. Levodopa is actually considered as the gold standard for as much as Parkinson's management is concerned. Parkinson is a type of condition wherein there is actually resting tremor, usually in the hands. There is slowness in movement, even in walking, and there is rigidity, usually in the limbs and in the trunk muscles. Levodopa is considered as the gold standard because it can actually mimic the problem, which is the hormone dopamine, for patients who have Parkinson's, and it is the only one that can actually cross the blood-brain barrier, which can halt or slow down the progression of Parkinson's. However, the study actually found that 55% of patients who have been taking levodopa are more likely to suffer with neuropathy symptoms. There are various mechanisms that can explain this. However, the most significant one is the decline in vitamin B12 levels for patients who had been taking levodopa. The risk factor for nerve damage for levodopa use is the use of it for greater than 3 years. Antibiotics. Fluoroquinolones like ciprofloxacin and levofloxacin have been found out to actually cause nerve damage in long-term use. Isoniazid and ethambutol, which are also antibiotics used to treat tuberculosis, have also been implicated with nerve damage. Let's look at isoniazid. Long-term use of isoniazid caused neuropathy symptoms in 2 to 44% of patients, and this had been linked to decreased vitamin B6 levels. Now, let's check about ethambutol. This actually caught me by surprise because the research actually found that ethambutol use of greater than 35 mg per day, which is used for several months, caused bilateral loss of vision or loss of vision in both eyes due to what we call as optic neuritis or inflammation in the optic nerve. It is good to know though that the vision loss was reversible as soon as the use of medication was stopped. Now imagine the inconvenience and the fear that it can instill to persons which are affected by this. Now before we continue at this point, I would like to ask a tiny favor from you to please click the like button below if you think that videos like this are helpful. Thank you. Other group of medicines that have been proven to actually damage the nerves are antidepressants. To begin with, antidepressants actually work by stabilizing or helping with the neurotransmitter serotonin to help stabilize the mood. However, this is where the problem starts because accumulated levels of serotonin can actually impair your body's or your nerve's ability to function well, giving you neuropathy-like symptoms. Immunosuppressive medications. These types of medicines are prescribed to patients who have problems like inflammatory bowel disease, psoriasis, and even rheumatoid arthritis. It aims to control your body's immune response. However, the study actually found out that long-term use of these medications can give rise to other autoimmune conditions like Guillain-Barré syndrome or what we call as GBS, wherein patient sensation is affected, plus it can even cause paralysis in the muscles, even that paralysis of the throat. Antiviral medications. These are the type of medicines that are used and prescribed for patients who are diagnosed with HIV. However, the research also found that long-term use of these medications can actually lead to neuropathy symptoms. In fact, this is one of the reasons why these medications need to stop if neuropathy had become too severe enough for the patient to bear. Anticonvulsants. Gabapentin and pregabalin are the most commonly prescribed medications used to treat neuropathic pain. They are actually anticonvulsants, and they actually help with the pain by blocking pain receptors in the spinal cord. However, it is amazing and ironic to note that long-term use of gabapentin can alter your pain receptors also in the body, which can eventually cause neuropathy-like symptoms. That's the reason why also I keep reiterating in this channel that you need to have comprehensive approach and you need not purely rely on medications alone in treating neuropathy. Chemotherapy drugs. Platinum compounds and taxanes are prescribed and used to treat different types of cancer. However, these have actually been found to cause neuropathy symptoms and damage to the nerves. You will find out later how to do about it to actually prevent these complications. Metformine. A study published in the Frontiers of Endocrinology last year found that metformine use had been implicated with hospital admission due to nerve damage and neuropathy symptoms. Although high blood sugar level or elevated blood sugar can actually cause damage to the nerves, there are 31 different studies pulled together and they actually found that patients who are diabetic who have had metformine greater than 2 milligrams per day have actually lower vitamin B12 in their body. Decrease in the amount of vitamin B12 have strongly been linked to neuropathy symptoms and nerve damage. These are the commonly prescribed medications that have been implicated with neuropathy and nerve symptoms. If you're currently experiencing neuropathy, try to check the certain medications that you have right now and see if these have been in any way exacerbating your symptoms. Now, what can we actually do to prevent this or actually augment the side effect? It is best to start with the lowest dose possible with the shortest amount of time. Most of these side effects or complications have been implicated with long-term use and with certain type of dosage. Feel free to talk to your doctor if you feel any neuropathy symptoms related to your current medication. Have a comprehensive plan. I keep on reiterating this, that you need not rely on purely medications alone. You can pair it with proper lifestyle choices. For example, in the case of statins, check your diet and do exercise because exercise have really been proven to actually lower cholesterol level. You can use vitamins and supplements. If you want to know about 7 validated vitamins which have been proven in research to help with nerve repair, I have a video here. Let this video help and guide you. Also, if you want to know about the top symptoms of vitamin B12 deficiency, you can check on this video here. If you're suffering with neuropathy symptoms, try to check and review the current medications that you have because even the most important medications sometimes can be implicated with nerve damage. If you have reached the end of this video, please comment informed in the comment section below. I hope that this video have been able to help and guide you. Thank you very much for watching. I will see you on our next video.